So the first point I'll be discussing is whether or not an outbreak of Ebola is possible in the US. And with any health, with any virus or any pathogen, I believe that an outbreak is definitely possible, given the correct circumstances and the correct conditions. But I believe that the an outbreak is much less likely in the United States than it is in West Africa because mainly the healthcare system in the United States is a lot better equipped and better regulated to deal with these sorts of outbreaks. For instance, in the hot zone, it was the nurses in the hospital were described to be using the same needles over and over to vaccinate their patients, which really exacerbated the situation and made the disease spread very quickly, whereas that would not be an issue in the United States. And furthermore, the CDC has already taken a lot of preventative measures, and they have already done a lot of work to make sure that an outbreak like Ebola will not spread through the entire United States. There's definitely more that can be done. First and foremost, there can be better training for nurses and doctors because the nurses that were mentioned in the article said that they didn't have sufficient information nor the proper protective gear to prevent them from getting infected. And another thing is more intensive monitoring for diseases for people that are traveling from in areas in which Ebola has already spread. And there should be much more funding for the discovery of a vaccine so that we can eradicate this disease for good. And one more thing is to ensure that all hospitals have sufficient facilities as well as resources. Isolation is really key in dealing with such an infectious disease like Ebola, and unfortunately, the hospitals that were described didn't have the same kinds of isolation wards that we see here in the U.S., and that allowed the disease to spread very, very quickly. So I think it's essential for maybe governmental organizations like the CDC to make sure that hospitals have access or have the isolation wards that will prevent Ebola from spreading and allow infected patients to be quarantined. The second point I'll be hitting is about the allure of working with hot agents and why these people do it and if I would personally do it. So I think that the appeal is that these scientists, these researchers get to save people from imminent danger, from these infectious diseases that could essentially wipe out thousands and thousands of people. And I think it's a really, really admirable thing that these people do. They're able to contain these diseases, discover the source, and potentially find cures and treatments and make sure that no other people die. Would I do it? No, because of the risk of getting infected, but I personally really admire the people that do it.